Yeah, like I'll just it's everywhere. I'll just wait for some viewers to get added, and then I'll start the video.
No issue, no issue, I'm fine. You just let me know and I'll put the camera and
Okay, sure. Okay, so we'll start now. So
you want to start?
yeah, let's start. Okay, so hello, good afternoon, everyone. Today we have with us Professor Shujoy Biswas, who is a member of WMHA, a mental enthusiast and a motivational speaker. And he's currently the CEO of Techno University and Group, and he's going to take us through a journey through mental awareness. So, over to you, sir.
Good afternoon to you all. I hope you are in the health of, I hope all of you are in the best of your mental spirits. If not, I think after this session, you will really be. You know, life is a very small journey between birth and death. When you have been born, it's sure that one day we're going to pass away from the earth. So we have to somehow manage the time in between. And if you have to manage the time in between, why not manage it properly so that your mind is happy, which reflects on your face is happy. You make the people around you in the family, with the friends, with your colleagues, or with your classmates happy, and you have a great journey of life. I have given the term that from shadows to light, a journey through mental health awareness. Why from shadows to light? Because most of the time, we are actually, trust me, Facebook doesn't reflect the actual mental state of us. Facebook or any social media per se, whatever we show in Facebook is not real. It's most of the time it's very fake. So health, I'd say that for wholesome happiness, four factors are very important. And the first one is that you should have a healthy life. Then the second is you should have a wealthy life. So second is wealthy life, healthy life, wealthy life. You people who say that they don't require money, either fools or billionaires. I believe that. The third is you should be emotionally happy. If you are not emotionally stable, then you cannot be trusted. Trust me, people are not going to trust you, neither you can trust anybody. So emotional happiness depends on your mental state of mind. So that is important. The health and mental health are all very important. And the last but not the least, spiritual happiness, which has also got something to do with mental health. Now I'll say some points on mental health and then some inspirational stuff which definitely is going to push you up mentally. So first I define mental health. The understanding mental health is not the absence of mental illness. You know, it's not but complete emotional, psychological and social well-being. So defining mental health, I define is understanding mental health and not just the absence of mental illness, but complete emotional, psychological and social well-being. Then there's the historical perspective. What is the historical perspective? It's how mental health treatment has evolved from primitive, often cruel treatments to modern psychotherapy and meditation. You know that there are now people taking counseling for a long time. So counseling, the very concept of counseling came very late, and the people in fact hindered to say that we are not mentally well. Like we have a pain in the abdomen, we say a pain in the headache, we say, but mental health we were not really discussing till date. We are not very comfortable. The situation has improved, but we are not very comfortable. So it has gone through several spaces, and there is a stigma with the society. The stigma historically attached to mental illness and how it affects individuals willing to seek help. Mental illness is often referred to as crazy or paglam. So it's not like that. It's like any other illness. Then there is a role of the media. The media portrayal of mental illness shifted from negative stereotypes to more nonsense, often empathetic portrayals. And people in positions, people who are known, like Deepika Padukone, have made it very vital that people in big positions with big fame, big name, big money can also go mentally ill, and they take the course to be taken to come out of that. Then we should have a public awareness campaign. Since mental health is going to degenerate the society, the impact of public health campaigns and in rising awareness and changing perceptions of mental health is very important. There's also necessity of a mental health education, integrating mental health education into school curriculums to promote early awareness. Most of the schools, most of the renowned schools these days have psychological counselors, psychologists who are counselors, because in this age whether one child or two child, people have their different kinds of problems which are not which cannot be diagnosed as mental illness, but they are. Now, while I talk of diagnosis, there are barriers to treatment also. Discussing common barriers like cost, lack of resources, and cultural stigma. If good schools have mediocre or schools in the lower end with challenging financial condition doesn't have that, so there are barriers to the treatment. And there's a global perspective, how different cultures views mental health. During the time of corona, I used to do a talk show called Corona Kahini Sange Sujoy, where I interviewed people across the whole world. 40 countries, people from 40 countries came to my show, which ran for 80 weeks. And I also had an interview of a psychiatrist, Dr. Anshuman Das, who said that during that time of corona, 90% of the people were psychologically affected. Only 10% came for treatment to the psychologist or psychiatrist, and that was a humongous number. And if generally also speaking, most of the people have some kind of psychological or mental problems, but we are not ready to discuss. Now, what is the impact of technology on this? The role of technology in improving access mental health resource and support is great. And technology is helping us to grow over this. এখনকার দিনে, in the current perspective, the advantage is that you don't have to go always to a counselor to take a therapy. There are provisions where you can take online therapy. And I quote, the rise of teletherapy, online counseling as legislative forms of treatment has helped to address the issue a lot, because people don't have to travel. People don't have to physically go to a counselor or a psychiatrist to find out, to make out what is the problem with him. They can, like I'm talking to conveying to you, they can do that. Then there are self-help movements. The growth of self-help and self-management apps for mental well-being is there. There are plenty of stuff on the YouTube where, in fact, I run a show, motivational talk show called Joyer Pothe Sange Sujoy. You can just type Joyer Pothe Sange Sujoy, Professor Dr. Sujoy Biswas. I'll give the link also, where every week I talk of motivation, I talk of 7 rules of success, I talk of motivational stories, I tell motivational stories, I tell motivational shayari. So these are you can through mine, and there are several of them whom you can listen to and get pepped up for that. But there is a difference. There is a difference between the stuff that I can do and the psychology and psychiatrists do. What I keep on saying, that I can help on from grouping from mental wellness, the borderline, to mental illness. But while you have a mental illness, technical mental illness, you require the intervention of a clinical psychologist or a psychiatrist. Be very aware of that. You have to know what is the kind of stuff that you are having. So whether a motivational talk or inspirational talk or inspirational videos is going to work, or you really need to have online counseling or offline counseling from a psychologist or a psychiatrist. If the psychologist feels that he or she is not able to address, he or she will refer to a psychiatrist. If a psychiatric feels that you don't have to get treated by medicines, he or she will refer it to a psychologist. For mental staff, support system is very important. Strong support networks for individuals suffering from mental illness. Then there is a great role of the family. The family dynamics play a very crucial role in mental illness, because they have to be supported. They have to understand. They have to accept that there is mental illness. There is also thing called workplace mental health, initiatives for support mental health in the work. There is so much of stress, tension, pressure of work. So workplace mental health is very important. Now the government has become aware and the government has made policies, and there are impact of government legislation on mental health and access and quality, healthcare access and quality. So government is making a lot of initiatives. Does it cover insurance? Does mental health treatment cover insurance? Yes, it does. Insurance companies throughout the country and throughout the whole world have taken this and have addressed this through their policies. What is important in treating mental health, like many other diseases, is early intervention. The importance of recognizing and addressing mental health issues. In the school, as I said, many schools, the, there are school counselors and play a pivotal role in early detection and support. They will they observe, the teachers observe some discrepancy in the behavior of the students, and they address it themselves first. They doesn't want to bother the parents, but if they find that it requires a 24/7 attention, then they also pass it on the students. In the workplace, teachers are not there. So who can counsel? If they are not, no one but the peer. There's a huge impact of peer counseling. The effectiveness of peer support and counseling in supporting mental health is of immense importance. So that is to be done. That is to be done. Peers have to take care. Then there may be crisis. Just a minute. Sorry for taking the break. So there is issue called crisis intervention, techniques and importance of immediate response in mental health crisis and early intervention. And there is also, sad but true, mental illness leads to a condition where there is a tendency to end the life by ourselves, and so suicide prevention is very important. So the strategies and programs, there are strategies and programs in reducing the incidence of suicide. During that time, if someone is finding, that's the reason that I've told that a journey through mental health awareness. During this awareness is very important, so that people understands that he or she is mentally not well. He has a tendency that to end his life because, well, mind goes wrong. It says that I have nothing to do with life. I'm going to end it. So suicide prevention is one of the stuff that has to be very, very carefully addressed. He has to be monitored 24/7. Even if he goes to the washroom or stuff like that, you have to take care that he cannot shut the washroom so that he cannot do any kind of stuff over there. Then there are therapeutic devices, so like CBT, DBT, psychoanalysis. So there are techniques of detecting how bad or how what stage it is. As of now, there are innovative treatments like virtual reality therapy, and the potential is huge. With artificial intelligence coming in place, one can read the brain where it goes wrong, the brain weaves and stuff like that. Then there is a holistic approach, incorporating holistic methods like yoga and meditation of mental health. 1 minute, just a minute. So there is a holistic approach, and there are veterans and mental health, addressing specific mental health challenge by veterans. Veterans, the people who are at the end of the careers, that doesn't have much to do, have resources to live their life. They also have mental. Then, as I said, there are children of problems, special condition consideration approaches for children's mental health that should be there. So it all accounts of the awareness, and this is a path. This is a path you have to travel, a journey you have to address, and you have to bring everyone from the shadows they have to the light. There are challenges solution mental health aging population. People, as I said, people who have retired and have nothing to do, nothing to worry about in life. Nothing to worry about in life is a worry in itself. Trust me. Then there is impact of social media. The social media influences mental health positively and negatively. In fact, you watch a television and there always seems that that the world is a very bad place and all the bad things happening. There are hardly any shows which talks of positivity, that there is life, there is opportunities, ample job opportunity, you learn a job. So there is a huge impact of social, and that's what I'm trying to create through my show, Joyat Pathe Shange Shuja. The life never ends. Life is full of possibilities, and there is no competition. If you work more than you get, then there is no competition. This I'm not selling. This US survey agency called Gallup says that 63% of the people in an organization are disengaged, another 24% actively disengaged. So that way 87%, remaining 13% works as much as they get. And at the end of the day, the the population which gives more than they get, there is no competition in that sphere. Then there is cultural competence in therapy. There are sensitive culture sensitive treatment. This is substance abuse and mental health. In fact, if you have a substance abuse, the kind of mental deterioration goes is different. The mental health first aid, straight training non-professional mental health. So in order to aware of them, the non-professionals, we don't have so much of doctors and so much of clinical psychologists that we need to go to we have to have the first level worker, the grassroots level worker. So that who can get in medical parlance, we said first aid to be given. The first aid sort of train people for that. Then there are biological aspects of mental health, how genetics and neurobiology influence, but we have to understand that. You have to understand that there is a genetic factor. That's what I say, that an inspirational speaker or a motivational speaker cannot address when the mental there is there's a break in the mental health. They can work up to the point where you have to go on inspiring, motivating, so it doesn't get into mental illness. But mental illness, there is there, and then trust me or not, there is psychiatric medication which definitely and surely helps, and there are millions and billions of people who have got benefited by that. It's not that taking a psychiatric medicine you have to take it throughout your life. There is a structured treatment, and the treatment is not much long. If you adhere to the basics, adhere to the doctor's points, you'll find that you can have the recovery and rehabilitation and you'll go back to normal. But you have to understand, like if a bone breaks and you have an operation, you have to give 3 months or 6 months time. You have to do physiotherapy and stuff like that. So also is like of the mind. If the mind goes wrong, you have to treat them equally. That if your leg is broken, you cannot rise up. So if your mind is broken, you cannot do normal work. You have to withdraw yourself. Otherwise, it goes deteriorating and it goes in an infinite loop. There are also mental issues for the homeless people. The people doesn't have that roof over their head. The gender issues, mental issues differ from gender to gender. There are mental issues of the male population. There are mental issues of the woman population, and their issues are different. There are mental issues of the LGBTQ community. They have their unique challenges. There should be support for them because they are human beings at the end of the day. There are issues with that comes with trauma. Trauma may be from an accident. Trauma may be from the demise of a very close one very suddenly. Then there is neurodiversity and society, embracing and supporting neurological diversity in communities and workplace. Then there is therapist burnout, addressing the mental health or health professional themselves. People who are addressing the mental health can have mental health problems themselves also. It is important to realize that people who are addressing mental health, they have their families too, they have their challenges too, and it can go wrong anytime. So you have to be very, very careful about that. And you trust me or not, art and music therapy plays a very important role, because the brain waves, it has been found in some study, I don't remember the paper, but it said there's certain specific brain waves which can rejuvenate your brain and make it work faster, make it work sharper. And such kind of music, the clinical psychologists or the psychiatrist can say, but I'm not very sure about them. But there are music therapies which works immensely. Realizing all this, now there is global mental health movements. International efforts and collaborations are made to improve mental health. During the time of pandemic, as I said, psychiatrists said that 90% of the people are mentally affected. And so COVID-19 made us learn how to cope with mental health properly. 10% of the people in a world of I'll address that. How can social mental health? If you can bring the questions after I one by one, I can answer. Otherwise, I'll forget the whole stuff. There are a few more points left, and I'll. So, pandemic, people lost their jobs, people lost their lives, near and dear ones, without any notice. So there is huge effect, and somehow we have come out of that. There are also issues of mental health in prisons, people who are locked up, decked up for their faults. But they are also human beings and they have also issues with mental health. Then there are also animal assisted therapies. If you have a pet, that can help you to ease out much of your stress. It has been found people with pets ease out their mental health problem with. And there are seasonal affective desires, understanding and managing seasonal impacts on mental health. There's seasonal, which mental health, which that doesn't happen all the time, but it may happen during the time in a professional life, very huge, or during the time of the exams, or during the time that you're waiting for your results to come out, and you are thinking that you're going to crack the exam, maybe for your high degrees, or for a great or a job or stuff like that. So that seasonal affective disorders have to be taken. And last but not the least, burnout and stress. Getting burned out, stressful, devastates your mind like anything. And you have to be, and people have the tendency at that point of time to consume a lot of junk foods and all, loses the mental health and also the physical health too. I'll go to my inspirational part. Now, before that, I want the questions that were being asked. People who are asking can ask the questions and I can answer one by one. Please, you can social media affect mental health. Yes, then how can manage? I'll start with a specific example. I keep on saying that people may be eating breads in their home, but they post in the social media that they're having the uh, mm, just taking breaks, but posting in the social media that they are having burgers or stuff like that, or pizzas with great tops. So people who want to have a pizza cannot afford, think that they are very lucky. So that's the kind of stuff. Then people think, I keep on saying that I practice what I preach, but most of the time we keep on posting on the social media what is not practiced. So that affects the human mind, because everyone is thinking that the other guy is able to do and I'm not able to do. At the time of pandemic, I used a statement. It's called the prayer of serenity, and that you should, that when socially something affect, so from the social media, you keep in mind that God grant me the serenity to accept things which I cannot change, accept things which I cannot change, courage to change the things I can, and wisdom to know the difference between what I can and what I cannot. Anything and everything in the social media should not be taken seriously. Anything and everything coming in the social media of some murders taking place, some kind of negative stuff. There are plenty of negatives in the social media which attracts a lot of views, which attracts a lot of reactions, which a lot of comments and stuff like that, and that affects the mental health of an individual. And we have to manage it, as I said, with a prayer of serenity. And you have to believe in yourself. You have to believe that science says that there's hardly any chance that out of 3 billion people, one is exactly like the other. So you have come The creation of being a human being is a blessing by itself. We are not animals. We have the best of the brains. So we have to believe in ourselves. We have to work in what we believe. We have to put in the hard work even when it hurts. The management guru Shiv Kera says successful people don't do different things. They do things differently. And what is the difference? They put in the hard work even when it hurts. So you have to, people who are successful cultivates the habit with the people who are not successful doesn't do. So we have to garner the habit which can lead us to success, and the main component is hard work. I, as a management professor, I say that that success comprises of two factors: hard work and luck. But harder you work, luckier you are. So you have to keep on working hard. And I'll say that you spend 2 hours on social media like Facebook, Insta, and stuff like that. You feel that after some time you'll feel that you've wasted your time. Spend the time on reading a book, on anything. It may be a motivational talking, it may be a spiritual book, it may be a technical book, it may be a literary book. You'll find much rejuvenated. So don't get stuck to the social media. Social media, I keep on saying, what is poison? Excess of anything is a poison, and excess of social media is a poison. So try to balance. It's very difficult. It's very difficult for including me. But on a note that I speak to, that I want to control myself from the social media so that it doesn't impact. Anything of excess is poison. Anything in the social media going on is a poison, and whatever is put in the social media is not to be believed. You have to apply your brain, the brain which should work, and you will be a happy individual. Any other questions? How to handle press during hard work pressure? Yeah, this is a very important question. First of all, that if you do not work hard, you are not going to succeed. Because as I said, that success consists of hard work and luck, and harder you work, luckier you are. So you have to work hard work. And why it's pressure and how the stress comes. Anything you love doing doesn't cause stress, doesn't cause pressure. If something you are doing hard work and it's causing stress and pressure, that means you are not loving the job. You have to keep on loving the job in order to really get released of the stress and the pressure. If you cannot, then you have to find ways and means to how to make that job enjoyable to you. You have to put extra effort. In fact, in the workplace, you may not get the time. So go back to your home, work on that. There are plenty of stuff in the social media itself, from the internet, from the chat GPT, from any other sites, from the videos, so that you learn your job properly. When your work becomes your passion, there cannot be any pressure. You know that beginners maybe have pressure because they do not know really how to handle stress, how to handle the work. But once you know what the work, and you have to keep on exploring that what you enjoy in life. If you don't enjoy, you don't have any stuff which you can which will not give you stress. Anything you not enjoy, even if you go to a movie and you don't enjoy a movie with your, or you go to a movie with your partner and he or she doesn't enjoy, that's going to have a stress that ye movie kab khatam hoga, when will this movie end? So this is you have to keep on loving and doing, and passion becomes profession, then there is no stress, no hard work. Will I continue with the motivational part, or will I end here, Bonani?
So I think that's it for now. Hello?
Yeah, Bonani, tell me.
I think we are done with the live.
Okay.
I think that's it for now.
No issues, no issues.
Thank you, sir.
So
Thank you for.
did you enjoy it?
Yeah, it was very insightful and it was really informative.
I jotted down the points because only motivational talking doesn't make a sense in a seminar where we're talking of awareness program and from shadows to life. What are the shadows we needed to discuss? So I actually jotted down points which I needed to convey so that it is documented. People, if it sees at a later point of time, people will feel that these are the issues, these are the awareness points. around 50 points which I discussed. I didn't say point wise, but I had jotted off 50 points on awareness, on shadows to light. And I thought that there may be two parts. One I talk on the points, and one I talk on the motivational part, which we may do at a later point of time.
Yes, sir, it was really good. Thank you so much for taking out the time.
Thank
Okay,
you. Thank you
so
so much.
thank you, sir. Bye. Take care.
Thank you. Thank you. Yeah. Bye.